Eczema is one of those conditions that can be difficult to deal with because medicine doesn't completely understand where it comes from. We do know that eczema has a strong inflammatory component. We just are not completely sure where the inflammation is coming from. So this is the type of thing that we need to look through and determine with you. Some types of eczema have an allergic component. This is called atopic dermatitis, and this is most commonly seen in kids, especially if the child was born via C-section or did not receive a lot of breastfeeding, because both of these are the main sources of the intestinal microbiome that kids need to develop their own. And when this doesn't happen, there can be effects on the immune system, basically creating more of a predisposition towards developing allergies. Once you have a diagnosis of eczema, we like to do some extra tests to determine what else might be going on with you so that we can determine the best treatment protocol for you. Some of the testing might include allergy testing to determine if your eczema is atopic. Another might be food sensitivities, to find out if there's anything that you're eating that might be making your eczema worse that we can remove while we're doing other treatments. The next one is cortisol testing to figure out how much your stress might be playing into your eczema. Stress is a big one that actually affects a lot of people and is very effective at improving eczema once we get stress under control. The last one is just a general assessment of the oxidation that's in your body. This is something that we can use to assess where you start with eczema, and then also to track it to see how our treatments are doing with improvement. Oxidation is something that happens when there is a lot of inflammation going on in your body, so it helps us to assess the severity of the inflammation and the amount of inflammation that you might be experiencing at any given time. So this will help us to determine if the treatments that we are doing are useful or if we need to go another direction. In terms of treatment for eczema, there are two different areas that we need to look at in order to effectively treat what's going on with you. One of them is a topical eczema treatment, and this is something that we'll do to help manage your symptoms in the meantime while we're working on deeper issues, as well as to help repair the skin barrier. In all cases of eczema, there is some sort of damage that has occurred in your skin, making it ineffective at keeping things out. These things might be allergens, bacteria, or other chemicals, and ineffective at keeping things like water in the skin. So this is why it becomes dry and flaky and you feel like you're dehydrated even though you might be drinking a lot of water. So aside from the topical treatment protocol, there's also an internal treatment aspect to eczema that we need to deal with. This might entail things like correcting any nutrient deficiencies, balancing your stress hormones and your stress response if this happens to be indicated for you, and various other things like herbs, diet changes, anything that we can do to help control inflammation while we deal with what's going on with your eczema.